If I had to go back and pick a specialty again, I would choose urology in a heartbeat. I think it's the best specialty.
When people leave here, they know how to operate and they know how to kind of do anything that gets thrown at them.
I don't think there's anything that any of us really would encounter that we're not comfortable with dealing with in the future.
This is like a powerhouse in urology. I'm very proud of the fact that I've been able to train here.
I feel like the Midwestern training style, you get a lot of autonomy, especially at a place like IU, where we get referrals from all over the state. I really knew that I could get exposure to all sorts of urology.
I did medical school here actually. The high volume of cases, the quality of the people I worked with here, the instructors themselves, and all the great information they've been able to convey for me during medical school was a huge impetus to stay.
When I came and interviewed here, I absolutely loved the residency group and saw how supportive everybody was of each other.
I wanted a place that had a bunch of different variety in terms of a county hospital, VA hospital, large separate private hospital, and a university hospital, just for the different variety of patients, different variety of experiences.
I wanted to go somewhere that provided the best surgical training possible. So when you came out of residency, you were very prepared. The residents that come out of this program are very competent and can really handle anything that's thrown at them, and I wanted to be a part of that group.
The major strength of this program is the exposure to different branches of urology and the training you get. It's one of those unique qualities that I think very few programs can offer.
This is the only urology program in the state. From the county hospital here at Eskenazi, you get your bread and butter urology patients. VA is sort of the same way, but then we're a tertiary referral center for cancer patients at university, so you see things that not a lot of people see every day, and do surgeries that you may never see again, just because of the complexity of the patients and of the surgery, and our staff's ability to be able to manage those patients.
One of the great things about IU is we have an extremely large diversity of cases that we're able to do. And we have fantastic staff that teach us a tremendous amount about every case and really help you excel surgically.
You get to see all sorts of different styles and different ways of doing things. We have urologic oncologists as well as reconstructive surgeons, so we kind of see two different ways to do a cystectomy and ileal conduit, for example. And I feel like the faculty really invest in us as residents too.
They're all very happy to teach and very excited to be here and to be kind of sharing this time with you and giving you a chance to participate for one, and then kind of learn how they do things individually too.
I think from the beginning on, I've really developed some camaraderie with the staff and the residents. When I was a junior resident, all the senior residents really took care of me, and now I get to do the same thing for the junior resident.
We work really hard and we work as a team, and so knowing that I can trust them and work together with them is really awesome.
I grew up playing team sports a lot, and this feels like a big team sport.
Here at IU, we have a great group where we both work really well in the hospital, but we also all hang out outside of the hospital too, which I think says a lot, because when you spend a lot of time in the hospital with people and you still want to see them outside, it kind of shows how close-knit everybody is.
Where I am now as a fourth-year resident about to be a chief, I can confidently say I think I made the right decision coming here.
I think our training really prepares us well for the real world as a urologist, and we come out confident in our clinical and surgical skills. And so I think that's what makes an IU resident really stand out.
We work hard and we learn a lot. So as long as you're willing to work hard, this program has everything that it can offer to get you out and be a confident urologist at the end of the day.
The kinds of surgeries we do are just really interesting and technical, but also rewarding and fulfilling. And I just think we have the best job in medicine.